Receiving health care benefits from the state employees health plan will see a change in third-party administrators. The state plan's board of trustees awarded the contract for services to Aetna starting in 2025. Blue Cross Blue Shield, the company that has held that contract for 44 years, is now challenging the move. State Treasurer Dale Folwell says the third-party administrator does not set premiums or determine what is covered under the health plan. That's up to the trustees. Folwell says nothing about employee health coverage will change because of the shift.
Blue Cross has never been the insurer for the state health plan. They've had this contract for 44 years. So they're not the engine, they're not the body, they're the transmission that simply processes all the back office claims for medical services for those that teach, protect, and otherwise serve.
Blue Cross of North Carolina issued a statement about its challenge to the move, saying in part, here's the quote, Blue Cross NC believes that its bid to the state health plan serves the best interests of the plan's members. The plan's response to Blue Cross NC's protest leaves too many unanswered questions about how the change will affect costs and access to care for state employees and teachers.